Hi guys, how are you? Happy Saturday. This is your girl Lisa Baxter, always giving you the 411 in the kidney world. Oh man, I don't know how much medication you have to take, but I have to deal with different types of medication. I didn't take that much medication while I was on dialysis, except that treatment. And then when I developed high blood pressure, stuff like that. You had to take the binders, of course, after every meal or, or during or whichever way you were instructed to take it. But I'm telling you, medicine is something. Medicine helps you, but medicine also lets you experience some things you didn't want to experience or ask for. I don't know if you ever um, read your prescription paper, but it has a lot of good information, not just the cost, but things you should ask your physician, things you should ask the doctor, things that the medicine causes or the things that the medicine doesn't interact with, because some medications, got bad side effects, or some have minimal and some have severe side effects. So it's good to have a good relationship with your physician, your team of at the dialysis center, your team, whatever hospital or place you go to or belong to, and even with your pharmacist. I was very close to my pharmacist at God Brewer Pharmacy, and they were excellent. They delivered my medicine no matter where I was at, on the moon, any borough I was in, at my house, my home, and everything. It was no charge to do that. I miss them. They changed my people, and I'm having some issues with that. But what you're going to do, you need your medication. And this show is called Meds, 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 or Medication, Medication, Medication. You know, so I'm your girl. That's my Rise Up East New York water bottle. And on the door over there, I have the mask and everything like that. I didn't know if you could see it or not. But anywho, let's get this ball started and rolling. I don't know about you, but some of the print on some of the stuff that they give you are so small. I wanted to show you the bottles of some of the medications as well. All right. So you got your vitamins, which vitamins is always good to take. You know, you got your prednisone, and I'm going to give you a rundown about some of the things that prednisone, what prednisone is about. So I got Amlodipine, Norvasc. They have generic names for stuff too, and you got, I can never say this, Tacrolimus, all right, Prograf. I don't know if you see these things good. I'm not trying to keep you. I just wanted to give you a little something. Okay, calcitrol, all right, for calcium, all right. And then you got your baby aspirins, or you know, your aspirins for, so you won't blood clot. And then you got your microphenolate, right? That's people that take, have transplants, right? CellCep, they have more than one name. Let's go down the line. Let's go down the line. Glipside, if you have diabetes. I developed diabetes after I got my transplant. It took a couple of years before it hit me, but it did. All right. So that's why I take the Glipside. It was 2.5. Now I have to take 5 milligrams of that. And okay. This is another bottle or different bottle that the prednisone came in. Sometimes you deal with different pharmacies. I've dealt with Walgreens. I've dealt with CVS. And Express Scripts, and one that start with an A. I always forget the name. I think I have it over there. All right. And Genevia, 50 milligrams. That's another pill they added for diabetes. Before, I didn't have to have that. So recently they did that to bring things down and to make sure Hannah do not fail. I've had my kidney 5 years. June 29th, 2016 made 5 years. Okay, so happy birthday to Hannah. Happy kidneyversary. And if you had a kidneyversary out there, happy kidneyversary to you. If you have a birthday this month or this summer, happy birthday to you. If you have a wedding anniversary or anything, happy anniversary, happy engagement, happy summer, and happy Saturday. These are some of the things, where is it at? These are some, make sure that's it, of the things you have to use when you take medication. And it has the days of the week, and it has morning, noon, evening, and at bedtime. I only take my medicines twice, and they're 12 hours apart. But this is what they gave me in the hospital. Later, I reduced myself to this because it was easier. But one thing I had liked about this one is that it not only had that, but I could carry it places, and it was easy when it opened and it snap closed and stuff like that. I could carry the whole thing or just one row if I was going out to eat or going out, period. And this one only have morning and night, which is cool. All right. And it has the days of the week as well. And it opens easy, close easy, open easy, and close easy. I have all kinds, even the little round ones you could put. I remember before, you would put it in a baggie or a tissue or maybe foil or something. You would carry it in. But now they got all kind of stuff to help you carry your pills and remind you to take your pills at that. Who knew? Well, we know now if we didn't know. Isn't that something? This is one of the diaries to keep up how I do the blood sugar. I was using this one first, right? And then now I use this one. All right. One of the charts that I got, it said if you were fasting, your sugar should be 100. Before a meal, it should be from 70 to 130. After a meal, it should be less than 180. And at bedtime, it should be from 100 to 140. All right. And normal was 80 to 120. Mm-hmm. I was trying to memorize that thing by heart. I had it down to a science, and one day I just didn't remember all of the little chart things. But I just would like to remember, what it is normal, maybe when you wake up and after a meal. So I reduced it to that so it'll be easier, so I know what to do. And this was the little thing I carry it in that has my alcohol pads in there, my little thing to put in the machine to tell me what the reading is, and the little thing that sticks me. Yes. And I've showed this more than once on the show before, so that's why I didn't really go into it. Okay, what else? What else? What else? So let's look and let's see. Did you guys see my shirt? All right, for the hidden salt. So this way you can see the calories on the shirt, the hidden salt, the hidden salt, and all kind of things. The amount of calories and the saturated fats. When you read a label, you'll see that because everything has labels now. Whatever's in there, the protein, the sugars, the fats, the cholesterol, everything. So I wanted you to see that because before I had the shirt that says about cut the salt, and I just wanted you to see it since I couldn't show it when I did my last thing, right? So you saw that part already. So I'm not going to show you because you saw it. Okay, now me Lodipine, I take 10 milligrams of that, right? And I take it once a day. So, if you wanted to ask a question in the chat, if you want to send me a message or an email or call me, my number is 917-825-9291. Or if you can email me, lbaxter272@gmail.com. Ask a question or let me know what you experienced with your medication. I mean, everybody didn't have a bad experience, but I know I've developed not only diabetes, you have to look out for other things that can come or occur. I kept telling them, oh, don't worry about it. High blood pressure had came back. It was gone. I was so glad it was gone. And then, diabetes, which I never had, you know what I mean? Then I end up with certain bone diseases and stuff like that, osteoporosis, arthritis and stuff like that. And some of that was from low calcium, long time of dealing with dialysis and stuff like that. And I had low calcium as a kid. And some of the medications just pull stuff out of you or from you. And but some of it does help too and save your life. I don't want to talk against medicines and stuff like that. I mean, I've done it all from herbs, all natural, to medications, and whatever it took to help me or save me or anything like that. Child, I tried it or I did it or tried to do it. How about that? So I want the same for you, whatever your choice is or may be. I'm just want to just put in a little bit of what I experienced and a little bit of education or a little bit of sharing. So if you experience this, you have somebody, a sounding board to talk back to. And I'm sure people out there, not just me, have dealt with some of this. All right. So Almeida pain, Norvasc, helps with my blood pressure. Okay. And it can cause liver they no when you going to the doctor, oh, they ask you before you take this medicine. I'm like, well, why they ask you that? And then if they know you have these symptoms or you have this condition, why are you going to prescribe me a medicine that can cause these things, or I'm not supposed to take it because I got this condition? So that made me think, or that made me like, what? You don't even know what to do with that. And sometimes you might not even have a choice about it, but I'm just trying to help myself and help somebody else, or just, I don't know, trying to work with this stuff because I have a transplant and I got to work with something. You know what I mean? You don't want it to fail. You don't want to mess yourself up. You're trying to listen, trying to do right. You already laid on the table and took the operation, so you got to do something. You already was hooked to a machine that you don't want to be hooked to, or you even came to terms with that. I had came to terms with that. I was just tired of going. I wasn't having no issues with dialysis. I had low blood pressure and I had low calcium. And I was anemic here and there sometimes. But most of the time I was very functional, kept a job and everything. How about that? Yes, Lord. Hallelujah. Shando. Fantabulous. Well, anyway, it can cause liver disease and heart disease. You got to tell the doctor if you have liver or heart disease, rather. If you let them know that I don't have heart disease and I don't have liver disease. You know what I mean? But some of the medicines I take, it says don't take it or let your doctor know. So I was wondering, what's the difference? I let them know, and then what? If it says, because it's alarming to the person that's reading it. I don't know about you, but that's where I feel. But I don't see the phone ringing. I don't see no text going on or nothing like that. But I just wanted to be open with you and allow you to say your piece or your feelings or what you experienced or what you wanted to share or say. Okay? All right, let's move on. I'm not going too deep into it, but I wanted you to just get an idea. Prednisone, Shando. I take 5 milligrams of that. All right. They say if you have diabetes, I have diabetes, high blood pressure, kidney disease, yep, osteoporosis, the doctor know all of that. All of my doctors, all the teams, the ones at the hospital, everybody, primary. You got to let these people know and connect them together. All right. It says, let them know also if you have heart disease or liver disease. All right. So they know that. You know what I mean? And prednisone can be a bad boy, a bad baby, cause a lot. Ooh, what a terrible steroid. My mother took that. Oh man, she had psychosis and some other things going on. She was bit in the Caribbean somewhere, and she came back, looked like she had malaria or something. Eyes was yellow and everything. She had spots and stuff. And my mother was a hardworking, loving, good woman. She already was diabetic. She didn't need nothing else going on, and she was able to deal with that, even though she was a bad eater at times. I think I would get that from her. I mean, I already used to eat well and good and perfect and wonderful, but you have your times where you supposed to eat something right that you maybe have not ate. Okay, Norvasc, Prograf, and prednisone. We're gonna move on to, let's see, cell set. All right, cell set. Now look how small this writing stuff is. Oh my goodness. I don't know if I showed you for all of them, but I'll give you that respect. So much that I had to write on the side of the thing because I couldn't hardly see it. I didn't want to be doing all like this and a little sideways, because sometimes I will do that. And let me see. And you got this here. The ink might be coming off. They rip easy, you know. But when they give it to you and it's stuck to the bag, clipped to the bag and everything, is like this. And it's all neat and everything, so you know how much you paid. It has your name, your address, and stuff like that on it. And then you open it up and learn the other stuff. You know what I mean? But they do consulting where they talk to you about it. You can talk to your doctor, you can talk to your pharmacist, or your team. You know what I mean? But learn how this stuff affects you. My aunt took some medication and didn't tell the doctor anything, and she died. You know what I'm saying? She was feeling bad, and she said she was feeling bad and how it made her feel, but she never said nothing to the doctor. I believe in having chats with the doctor. I don't have no problem with it. Mine's on speed dial. Oh yes, I got his email, his cell phone number, the office number, and the after hours number. How about that? Advocate for yourself. You know what I mean? It don't mean you be nasty or a pest or anything. Even to get this that I didn't want, you need a prescription. Even for my walker, you need a prescription. So, some these things don't cause side effects, but it can cause you to always depend on it. But it's very helpful, like having another leg. How about that? Without surgery. So, let me get with this here. Said I wouldn't keep you long, so I'm counting up the time. Not bad. So with this cell set, right? The generic name is microphenolate. Got it. All right. It can cause miscarriages if you're pregnant, and it can also cause birth defects in the baby. Ooh, that's a terrible deal. Terrible deal. Bad as I've had miscarriages and wanted a baby. But I mean, I wasn't taking those pills and stuff or this at the time. I was just trying to get pregnant, and it was hard with kidney disease and stuff. But I did get pregnant more than once and lost all of them. So, be careful out there. Always have conversations with your doctor and let your family know what's going on too. Sometimes, God forbid, if you're in a state where you can't talk, move, or do anything, you would definitely want some kind of help or assistance and stuff like that. My family had the nerve to wake up, and now I hope they don't come in here. I lock the door. You know what I mean? Because I don't like to be even though it's a reality show where you're going to get interruptions and stuff, especially when you share things. I hear the baby, Shondo. All right, so it can also cause brain infection. Brain infection, that's a terrible thing. It has many causes. It may even cause death. Now, that's very serious. You only got one life. I'm not, I understand about the Lord and Jesus and born again. Thank you, Jesus. I'm glad to be that. But right now, while I'm here, I don't want you to push me off the earth, or push me off into death. I need to know, you know what I mean? So it'll make you afraid to take this, or make you shake your head, or panic, or scared, or feel maybe even a panic attack. I was reading where the thing said it caused cancer and caused it. The matter of fact, it's this one. You know what I mean? So, death, weakness on one side of the body. Come on now. Who wants weakness? Muscle. Can't control your muscles. You know what I mean? Some confusion. I didn't need that. I'm getting older already. That's you. No, I'm just kidding. But I mean, that's a serious thing. I try to make the thing light as possible, but it's too real and too true to do that. You know what I'm saying? And I try to even do skits so people are understanding some sort of way, because some people can't understand when you talk to them heavy, deep, or serious. It might be too much for them to take in, or might go over their head, or they just don't want to deal with it or hear it. So I understand that too. You know what I mean? And you get so tired of hearing crazy stuff and sad and weird stuff that you don't want to hear nothing else. Or, or you just can't take another thing. But I'm telling you, this stuff arms you and make you a stronger warrior if you know it. Education is the key, and prevention. If you can prevent yourself from being on dialysis, prevent yourself, or if you don't need a transplant or anything like that, and you are functioning well, do it any way you want to do it. You functioning well on dialysis. You was at the point where they was going to give you dialysis, and now you're doing where you're not even getting to have to need dialysis or a transplant. Whatever works for you, because nobody knows like you. Nobody carry your body around like you, deal with the things you do. We all have a story. We all testify. We all got victories, triumphs, and we got things that upset us, depress us, make us angry, mad, hurt, and don't understand. But I hope you get some understanding today. This medicine also causes skin cancer, lymphoma, all right, viral infections, all right. You can lose weight, you know what I mean, and digestive issues. I already had that before all of that. You know what I mean? Where stuff didn't seem like it digests. Or where I remember one doctor, I was talking about it on my last night's show, that, he saw stuff in my blood from a little prick of blood. He said, oh, you ate this, that, and the other, and your food is still there and it hasn't digested. How long ago did you eat that? It should have been digested by now. So I didn't need that. This can also cause vomiting and diarrhea and stuff. Who needs that? You out in the street, well, you don't need no accidents or no incidents either, but this stuff happens, you know what I mean? So, I bought everything for every occasion, you know what I mean? And I've talked about stuff on my show, and I don't get paid for that, but I'm just showing you the stuff that helped me. I want it to help you in any way that it could help you, any way that it can help you out there. You know what I'm saying? Let me see. Vomiting, diarrhea, bruises. I always had bruises and stuff. I was showing some of them on Facebook. I had them on my chest. I had them on my arms. I had them on my thighs. But before, I didn't notice or knew that it do that. You know what I mean? So you got to keep up with everything on your body and with your body, your GYN appointments. I always hate them, but you got to just jump on that table. I have a special thing that they have to do something to give me something really small. And it's embarrassing and a shame because, some doctors talk a lot of junk to you. You think, oh, come on. I only had one partner, but still, don't bother me about that. I'm already nervous and scared. My legs shaking all over. You got me on the table and stuff like that. Come on. And then sometimes they can be rough with it, and everything. I already got to do other stuff in there. You know what I'm saying? You was like, in there too long. What's up there? What's in there? Stop it. But anyway, be healthy. You know what I mean? I have a nice lady that work with me, and she know I'm scared and everything. She just work with me. I'm scared if she quit or move to another country, I might have to go to that country. Because I have not found no other GYN that was like that or understandable. You're a woman, stop that, or I don't know if they assume you had a baby or what, but they supposed to know all of that. There was miscarriages, nothing came through there. So anywho, urine pain. So this medicine can cause urine pain. All right. Ear and headaches. I used to have ear and throat infections, years ago when I used to catch colds and stuff all the time and everything when I was younger, before I was even on dialysis or I had a transplant. So this can be scary, but I'm glad that I haven't had any of those things that they said. You know what I mean? Or dealt with any of those things. To God be the total glory. I pray, I anoint myself, whatever I have to do, to deal with these things. And you do whatever works for you. That works for me. Prayer works for me. Knowing what's going on in my body, talking about the side effects or what can be caused. So I have to know. I really have to know. I forgot to put those things in my ear. Now I can't believe I forgot that. And it's sitting right here. Shando. Oh, gosh. I'm about to end it though. Isn't that something? And then that would have killed some of the noise because I gotten used to using that. Now I forgot. Shut it up. But I was going to physical therapy, and they gave me sometimes when you have to do physical therapy at home, they give you different exercises to do the physical therapy at home. So I thought that was way cool and stuff like that. Stuff on my back, stuff you gotta lift your legs and stuff like that, and to the side and everything, and hold it still. And you got five. You have to repeat it 5 times or repeat it 2 times. You know what I mean? Or do up to 15, hold it for 10 seconds or whatever it is. But this was very helpful to me, and I don't know if you could or would see it. So I'll try to do it that way. But I'm telling you, they got stuff with a ball and everything. If you need physical therapy, it can make you stronger. If you need to exercise, if you have to walk around your house or walk up and down your stairs, if you're able, or walk around the block, or go visit a park, or walk a certain amount of blocks a day or a week, whatever you want to do it. But the more often you do it, it gets the blood flowing, it gets circulation going and stuff like that. And it's been known to help some of the diseases that we may have. You know what I mean? So they always say diet and exercise is important. So invest in diet and exercise, whether it be free, whether it be at the gym or a senior center, or some of them your health insurance cover. So I've seen some and I liked it and everything. I think they did me under the table, I guess, because I had walked so many blocks and I went right into the aerobics, and everything. I said, well, I'll go with the seniors. And I wasn't supposed to be in that class, but I mean, they was at it and they was holding it together. You know what I mean? So they just exercised me right under the table, but they laughed. But the instructor told me because I walked and came straight into doing the class, that's why I was tired or out of breath or whatever I was. But normally that wouldn't affect me when I was younger. So it goes to show you again, you learn something about yourself all the time. You learn something new about yourself every day or every decade. I know every decade was different, and I was like, ooh, or what? Or, oh, and you find yourself acting like your parents sometime, or acting like somebody you said you would never act like, or do something, so God help us all. You want to be true to your word and everything, but be true to your body, be true to your health. I say V for victory. You know what I mean? And take care of your kidneys and they will take care of you. Sharing is caring. Continue to share the Lisa Baxter Show. Make it go viral. The many people I believe that it would reach, and it has reached in the 12 years, that I'm just grateful for that. And I never got paid for it. And I'm not saying anything about that, but I'm just saying sometimes when you love people or you love what you do or you like doing something, you would do what you can. So now it's time to do movies and commercials and bring it to a higher level to let more people know. So more programs are using the videos and stuff. I thank God for that. And more people are using it too, for their workplaces and for their organizations. I appreciate that too. You know what I mean? Wherever I couldn't physically go, the shows go. And wherever I couldn't physically go, my books go. Through the eyes of a dialysis patient, Melzy takes dialysis to Chantal. I thank God for that. I thank God for being on the cover of Polycystic Kidney Disease magazine. That was a great honor for me. Even the ESRD network asked me to do a podcast. And I was like very honored, and I'm about to end my show and take a long rest, about 2 months or so. And if I don't get to do the group shows that I wanted to do, it was in my heart to do it, but I can't do anything if nobody wants to do it. But I did want to do a show called Ask the Author and use some of the authors that been on my show, or even authors that haven't been on the show. So if you're an author out there and would like to be a part of it, I wanted to do that this month so I can rest September and October. But if not, then I might do it in September. So, and I'm hoping not, because I don't want to really do anything in September. But I love you guys. You guys rock. You are fantabulous. Keep us in prayer. Keep my family in prayer. Keep us all in prayer. We love you. We care about you. Don't you ever forget that. I don't care where I'm at or where I go. You're always in my heart. and I'll always care. And I got enough videos. You can go all the way 12 years back and find it. So whether it's on cable or Google or YouTube or wherever it's at, you'll be able to find the Lisa Baxter Show. All right. You'll even find it on Urban Health. All right. I did that 2 years with them, 2.5 years. So y'all be good because this is the Lisa Baxter Show, giving you the 411 in the kidney world. Oh man, I'm gonna miss y'all. Y'all been my family too long, but you still will be. Okay? So we'll keep up with each other. God bless. A billion blessings. What they say, peace out. They probably don't say that no more, but whatever it is, I know blessings is in. They'll always be in. Shando Kobo Shay, Kobo Shaya, Rabba Shaktiya. Love you. Yep. Mm-hmm. Yeah.